Here we will draw the anatomy of the spinal canal, beginning with a sagittal section through the spinal cord and brain stem. Draw the brain stem at the top and then continue it as the cervical segment of the spinal cord, which angles anteriorly, the thoracic segment, which angles posteriorly, and the lumbosacral and coccygeal segment, which angles anteriorly again. Next we will draw the vertebral bodies. There are 7 cervical, 12 thoracic, 5 lumbar, and 5 sacral vertebral bodies, as well as 1 coccyx. The shape of the vertebral column is more challenging to draw than that of the spinal cord. First, consider that the spinal cord ends at the L1 to L2 vertebral column level. Thus, in any axial segment, the spinal cord level is lower than the vertebral column, and the vertical difference increases the lower you go in the vertebral column. For the vertebral column, simply draw the superiormost and inferiormost vertebral bodies in each segment. Show that the upper vertebral column, C1 to C7, follows the anterior curvature of the cervical spinal cord, and that the upper thoracic vertebral column, shown here as T1, follows the posterior bend of the upper thoracic spinal cord, but show that the thoracic column bends back anteriorly in its lower thoracic segment, shown as T12, in order to accommodate the lumbosacral spinal cord, which angles anteriorly. Next, show the vertebral column bend back posteriorly again in its lower lumbar segment, then draw the sacral vertebral column with an even sharper posterior angle. At this hyperflexion of the sacral column, show the clinically important L5-S1 junction, which is a common site of nerve root compression. Now show the coccyx angle back anteriorly. A pair of motor and sensory roots exit the spinal cord at each level and combine within an intervertebral neural foramen to form a spinal nerve. Certain nerves pass above the vertebrae and others pass below it. Thus the numbering arrangement for the nerves and bodies is confusing. There are 8 numbered cervical spinal nerves, but only 7 cervical vertebrae. All of the rest of the segments, thoracic, lumbar, sacral, and coccygeal, have an equivalent number of nerves and bodies. Show the first cervical spinal nerve, C1, exit below the skull, i.e. beneath the foramen magnum, and above the first cervical vertebra. Then illustrate that C2 exits above its vertebrae, and so on. Show C7 exit above the C7 vertebrae, which is the lowermost cervical vertebrae, so where does C8 go? C8 exits underneath the C7 vertebrae and above the T1 vertebrae. Where then must the T1 nerve exit? Below the T1 vertebrae, because the space above it is filled with the exiting C8 nerve. Only the cervical nerves exit above their related vertebral bodies. C8 and all the nerves below it exit beneath their respective vertebrae. Show T12 exit beneath the T12 body, L1 beneath L1, L5 under L5, S1 beneath S1, S5 under S5, and the coccygeal nerve underneath the coccyx. Now label the collection of nerve fibers that traverse the caudal spinal canal as the cauda equina, which is the Latin term for tail of the horse. The anatomically related thread-like fibrous tissue that extends from the distal tip of the spinal cord through the caudal spinal canal is the filum terminale. Label the most distal bulbous region of the spinal cord as the conus medullaris. Conus medullaris syndrome will produce upper motor neuron symptoms, whereas cauda equina will produce strictly lower motor neuron symptoms. Next, let's label the meningeal coverings of the spinal canal. Label the surface of the spinal cord itself as covered with pia mater, then draw a combined layer of dura and underlying arachnoid mater. Show there is plenty of separation between these meningeal coverings and the underlying spinal cord. Label the naturally occurring space between the arachnoid and pia mater layers as the subarachnoid space. Show that the site of fluid collection during a lumbar puncture is in the lumbar cistern, the subarachnoid space below the level of the spinal cord. Finally, draw the vertebral arch, which is the posterior portion of the vertebral column, and between it and the dura mater, label the epidural space. This concludes our drawing of the spinal canal.